Morning if you're in the UK, good afternoon if you're here in the UAE, and welcome to the Dubai Advantage webinar series on healthcare, talking about sector opportunities post-COVID. My name is Joe Hepworth. I'm the CEO of the British Centres for Business, the BCB, and this is the third webinar in a series we're running with our friends and partners at Dubai FDI. We've done ones already on food and agriculture, on technology, and next week we're going to be covering logistics. Today's webinar, we've got a number of speakers for you. It will last approximately 1 hour to 1 hour and 20 minutes when we've got speakers from across Dubai government to give you all a flavour of some of the things that are happening in the UAE and some of the ways you can get involved. I'm also pleased to welcome colleague from the UAE-UK Business Council to the call, and colleagues from Dubai Health Authority, Dubai Science Park, as well as our friends at Dubai FDI. Firstly, I'll start with something of an apology. I'm afraid His Excellency Mr. Fahad can't join us this morning. He's just been called into an Executive Council meeting. However, his colleague Ibrahim Ahli, who is the Director of Investment Promotion for Dubai FDI, is going to open the session and give you a flavour of some of the initiatives and some of the things Dubai government is doing on a strategic level to make Dubai an attractive investment and business destination for UK companies in the healthcare sector. Ibrahim, over to you, please.
Thank you very much, Joe. It is a great pleasure for Dubai FDI and the stakeholders from Dubai Health Authority as well as Dubai Science Park to join this valuable webinar on the healthcare sector. Ladies and gentlemen, on behalf of our CEO, Mr. Fahad Gergawi, we do apologize that he couldn't be available at this stage, and as he was called on an urgent matter in another virtual meeting with the Executive Council. Well, I'll give this speech on his behalf and welcome you today to join us and explore the opportunities in Dubai's healthcare sector and how British businesses and investors can benefit from them. Creating a robust healthcare delivery ecosystem has always been a focus area for the government of Dubai. Earlier this year, the advantage of that foresight was visible when we were able to deliver an effective response to contain the spread of the coronavirus COVID-19 and also provide a robust business stimulus packages. First of all, I would like to thank both the OCO Global, our strategic partner, as well as the British Centres for Business, BCB, for helping us to facilitate this webinar for today. And to give a comprehensive picture of the opportunities in Dubai's healthcare sector, representatives from both the Dubai Health Authority and Dubai Science Park will join my team here later on to share with you the Dubai Advantage and the city's preparedness for inviting investments in the sector. Ladies and gentlemen, I would like to give you some numbers that make the relationship between the United Kingdom and the United Arab Emirates so strong. First of all, the value of bilateral non-oil trade between our countries was a robust, and that is around 7.75 billion British pounds in 2019. And that does increase year after year. The UAE is the largest market for the UK's exports in the region. It commands 40% of the total volume for trade between GCC countries and the UK. The direct investments by the UK in the UAE's markets exceeded 71 billion dirhams. That's around 15 billion British pounds in 2019, while over 58 billion dirhams, which is around 12.4 billion British pounds of investments flowed the other way. Our data show that Dubai received 1.3 billion British pounds of FDI from the United Kingdom in the first 9 months of 2019. And this is an amazing 187% increase over the same period in 2018. So that clearly really showcases that the British business sees a huge opportunity in our city. This is why more than 120,000 British citizens live and work and invest in the United Arab Emirates, and around 6,000 British companies, including some market leaders, operate in the country's markets, such as BP, Shell, Rolls-Royce, BAE Systems, HSBC Bank, Marks & Spencer, and Waitrose, are some of the many major UK companies operating in the United Arab Emirates. These numbers are testimony to the intent of both countries to strengthen bilateral ties. High-profile minister-level discussions continue to explore increased bilateral cooperation and investment opportunities in priority sectors, which include the healthcare. Dubai has a tremendous geographical advantage, being positioned between Europe, Asia, and Africa. This positions us ideally to also attract medical tourism. We enhance this advantage with the high quality of medical facilities. In 2019, to reach 350,000 plus compared to 2018. The majority of them were Asians of 34%, followed by the medical tourists from the Arab and the Gulf countries of 28%, then followed by the European countries of 17%. Considering the high demand for specialized and tertiary care, Dubai is developing centers of excellence in specializations such as cardiology, neurology, and rehabilitation, which continue to be attractive areas of potential investment. Obviously, my colleague, Dr. Ibtesam from the Dubai Health Authority will elaborate further on that. On the industrial side, production of generic pharmaceuticals and the manufacture, sale, and service of medical devices have emerged as subsectors with high potential. Ladies and gentlemen, as one of the world's leaders in healthcare, the UK has already recognized the potential of the UAE market. Some of the UK healthcare brands that have established themselves in the UAE are Moseley Health, Moorsfield Eye Hospital, Imperial College London, and the King's College Hospital. In spite of the challenging global healthcare situation this year, Dubai continues to attract healthcare investments. World-class healthcare is one of the primary goals of the UAE's national agenda in line with the vision of 2021. The Dubai Health Strategy for 2021, announced by His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President and Prime Minister of the United Arab Emirates, as well as ruler of Dubai. It aims to develop a comprehensive integrated health service system that encourages early detection and regular checkups. The UAE's healthcare market is developing rapidly. According to Business Monitor International, the country's health expenditure surpassed 62 billion dirhams in 2017. That is around 13 billion British pounds. And it is expected to grow around 16.2 billion British pounds by 2021. Healthcare spending is projected, Healthcare spending is projected to account for 4.6% of the country's GDP by 2026. All of this makes healthcare one of the most robust investment opportunities in Dubai. And I would like to assure you that the Dubai FDI, with the whole of our team, is available 24/7 to help make your investment journey in Dubai seamless and successful. I'd like to thank you very much for your kind attention, and we very much look forward to support your presence in the future in Dubai. Thank you.
Ibrahim, thank you very much for setting the wider trade and investment context. And obviously, this year, healthcare is the key global issue, and I think both from a UK UAE perspective and just from living here in the UAE, that the way that has been managed has been a sort of a position of global leadership, if you like. Moving on to our, actually, just before I introduce Brad, actually one thing I should have said at the beginning of the session was everybody who's attending and who's registered will send you the links and the slides. So everything you see here you'll get. Also Q&A, that there is a Q&A box and on the bottom of Zoom there. Please put in any questions you have for the panelists, and we've got a session at the end. So we would encourage some participation, and we've had some questions in already. So anyway, back to the program here. I'm delighted to introduce Bradley Jones. Brad is recently appointed as the new Executive Director of the Joint Secretariat of the UAE-UK Business Council. since it was relaunched just last month. Brad's actually over in Dubai, UAE this week. He was saying he was in Sharjah yesterday, is in I think Abu Dhabi tomorrow. So getting into it despite obviously the difficulties with traveling. Brad, I think we'd all love to hear from you on some of the initiatives that the Business Council is undertaking and the direction that you're heading in. So over to you.
Great, thanks, Joe, and great to be connected with everybody virtually. So I'm in week 5 of the Business Council now, and the Business Council is still going through a period of transformation where we're really thinking through how we can add value and raise the level of engagement between the UK and the UAE on the whole spectrum of trade and investment issues. One aspect of that transformation is that we have established a joint secretariat that I run, and that joint secretariat supports and represents the interests of our UAE members and stakeholders, as well as the UK members and stakeholders as well. We have 2 relatively new co-chairs of the Business Council, Sir Ed Lister, the Chief Strategic Advisor to Prime Minister Boris Johnson, and His Excellency Ahmed Ali Al Sayed, the Chairman of Abu Dhabi Global Markets. In terms of what the Business Council is and how we're developing it, our aim is to be a forum for thought leadership and dialogue between the UAE and the UK on a range of trade and investment issues, discussing trade policy issues, market access barriers that perhaps are impeding collaboration between our 2 markets, and also identifying emerging trends and future opportunities. We do this by bringing business leaders and entrepreneurs together across a range of sectors. We'll be expanding our membership, so we're looking to invite new members from both countries, from SMEs, entrepreneurs, as well as large corporates, and not-for-profits as well. And as part of our transformation, we've established some new working groups. One of those working groups is on the healthcare sector. That working group is co-chaired by the Right Honourable Lord Kakar, who is a Professor of Surgery at University College London, and is also the head of the Thrombosis Research Institute in London. And his co-chair on the UAE side is Professor Alawi Ali Sheikh, the Dean of the College of Medicine at Mohammed bin Rashid University. They're at the moment building their membership of the working group and identifying the themes and priorities that they're going to take forward over the course of the next 18 months. But some of the things that we will be exploring are opportunities for future collaboration in digital health, in pharmaceuticals, smart hospitals, and I think there'll be a particular focus on child and adult mental health and well-being. Those are some of the priority things, but we'll be looking at the whole spectrum of healthcare. So we'd be delighted to hear from healthcare companies from both the UAE and the UK who are interested in contributing to the work of this working group. And I think my contact details will be on the last slide at the end of this webinar. So I'd be delighted to hear from you and get your thoughts and welcome your contribution to the Business Council's work in this area. Thanks very much.
Great, thank you, Brad. And I think I echo that my understanding of the way that the Business Council is going is going to be much more accessible and to SMEs and smaller businesses. So I would encourage everyone to sign up for Brad's newsletters and keep an eye on that because that's where it's heading. Okay, we're going to move on now to just a little bit about BCB and why we're doing this and who we are. Next slide. So we are the Department for International Trade's delivery partner here in the UAE, and we've been doing that since about 2013, about 7 years now. Over that time, we've delivered almost £90 million worth of export wins on the bilateral trade. We've helped 45 companies come in and set up here through a special incubator that Dubai FDI was instrumental in facilitating and supporting. We've done lots of trade missions with the likes of the Midlands Engines and things. And we work across the board with a lot of the actors, if you like, in the UK UAE sort of business relationship, the devolved authorities from Scotland, Wales and Northern Ireland, obviously DIT, the British Chambers and the British Business Group. And I think the point here, as much as anything for you as UK companies, is that there's a huge network of goodwill and support that you can tap into, like the Business Council, like the BBGs, like the teams at the embassy, commercial companies like Santander, all of whom are active in this space to support you on your trade and investment journey between the UK and the UAE. I mentioned there that we were sort of the Dubai FDI's sponsorship, if you like, of what we've been doing, and we now have a relationship as well with Dubai SME, where what we do is we're a certified incubator, and Dubai is very supportive of this in terms of the skills, knowledge, and technical transfer that when we're helping companies come in and set up in the UAE. Really such an important part of that, and particularly in the sector we're discussing today, is around getting that IP and those skills into the country, as I think we'll come on to when Waleed speaks later, around the economic diversification plans and healthcare and knowledge industries being so important to that. Bringing in not just new businesses, but new skills is vital. And we've been very active in the healthcare sector. I mean, just in the last few months, I mean, there's been a huge increase in the number of inquiries and projects we've been doing for British SMEs looking for support, market research, wanting to find out how to do business here. Every year we've been involved heavily with DIT and the likes of Midlands Engine and Scottish Development around Arab Health, which is the big trade show, which traditionally happens in end of January, beginning of February. Next year, it's actually already been scheduled and pushed out to, I think, the beginning of June, which I'm sure those of you in the industry would know. But actually, of all the sectors and all the trade shows we cover, I would say that Arab Health is probably the most impressive one in terms of actually winning business and being in the market. So we've got a strong healthcare practice here. My colleague James leads on that and works with the teams at the embassies in Dubai and Abu Dhabi to look after UK companies here. We do cover multiple sectors. We've got a very multinational, multicultural team. Our team, I think we've got 12 people, and we're made up of, I think, 8 different nationalities, which is quite representative of the UAE in terms of our identity. Healthcare, technology, and food and drink are probably our 3 biggest sectors, and continue to see growth in those. In terms of what we offered, I already mentioned that we had an incubator platform here. This is something that we developed with Dubai FDI in order to help British companies come in and set up and hold their hands for now up to 5 years, whilst they get their business up and running and keep them on the straight and narrow, if you like, whilst sort of able to win work, open local bank accounts, become VAT registered, all the things you might need to do here as a local supplier. And this has been a very successful element of our business and of the UK UAE cooperation. And in general, I mean, particularly in sort of medical devices and in pharma, we tend to get asked for more support in this area around market research. Help me find an agent, help me find a distributor, help me understand the regulatory concerns and things I need to understand from that. So that team that you saw earlier, that they take care of this in terms of really, if you need your handheld when you're coming to visit, now, if you need your handheld on a virtual visit, we can do all that through our trade team. Now we're going to get on to the sort of the meat of the meat in the sandwich. We'll start with a small video just featuring Dubai's position as a health tech hub and a health tourism destination. It's always a relief when those things work. So now I'm going to hand over to our colleague from Dubai Health Authority, Dr. Ibtesam, who's the Director of Investment and Partnerships, Investment and Public-Private Department. Doctor, welcome to the webinar. We're all looking forward to hearing from you. Dubai Health Authority has such a central role in this as a regulator and as a market maker. And we're looking forward to hearing from you.
Sure. Thank you very much. I would like to thank FDI and BCB and the team who have invited me and give me a chance to be with you this afternoon and this morning. For the people who are from UK to listen about what the Dubai Health Authority is doing in terms of investment in healthcare and public-private partnership. There is a various opportunities in the markets in healthcare, and definitely I will present to you what's there, and I will speak to you a little bit about the capacity planning, about Dubai itself, and about the projects and some of those projects as a public-private partnership. Next slide, please. So basically, this is a very important slide. In 2019, January, the 50th Charter was being announced by His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President and Prime Minister of the UAE and ruler of Dubai, that the doctor for every citizen. So that definitely was before COVID-19, and such a program was so important in terms of the accessibility for the individuals, whether they're residents or they're nationals, toward the healthcare facilities, and the accessibility in both ways, financially and physically or medically accessible, and availability of those services to the patients or to the clients. So this was a very important initiative, was being mandate from His Highness to the Health Authority, and it was being adopted and utilized extremely well during COVID-19, and helped a lot of the customers to seek their queries and their concerns in terms of the healthcare services. Next slide, please. So let me speak a bit why Dubai. Dubai is a vibrant city, and it has a lot of opportunity for professionals, not only for investors and entrepreneurs. And we know that there are around 200 nationalities. We are 84% of our population aged between 15 and 64 years old, and this is basically will show you why we are a young population and what kind of services we need to focus on to cater those populations, and according to the prevalence of disease, cardiovascular disease, and then oncology, road traffic accident. These are the major concerns in this country and even in Dubai. And of course, we are considered to be the hub and one of the top 10 in economy, and the gateway in terms of the transport because of the aviations and the port that we have. Next slide, please. So this is a very important slide as well. Basically, this to show you how the regulatory body is functioning in Dubai. We do have three major bodies acting in terms of licensing and regulation. However, 90% of the licensing and regulation run by Dubai Health Authority. 10% is run by the DHCC as well as the Ministry of Health. DHCC is Dubai Healthcare City, and they're based in the free zone. And you can see as well from the statistic, there is a growth happen in terms of the hospitals, facilities, as well as the professionals from 10 years or 10 years back until now. So there is a great growth in the private markets, and there is a great market share from the private sector. It's used to be before public-private sector. Public used to take the major stake in terms of the outpatient and inpatient. However, now 80% and 70%, 80% outpatient, 70% inpatient, respectively, carried by the private sector. Next slide, please. And because of the mandate of the health insurance, of course, the expenditures has been rising about 12% per annum from 2012 to 2017. And that has been an increase of the expenditures as of from 9.9 billion to 17.4 billion dirhams, and this of course is going to rise up to 24 billion dirhams in 2020, and we consider to be one of the top healthcare services in among GCC and Middle East, and our GDP is about 3.6%, comparing to the GCC country. Next slide, please. Okay, if you look at the health investment strategy in Dubai, our department is basically established in 2017, and we have done a lot of strategy work to improve the environment of the investment within Emirates of the Dubai. So we have done a huge study in terms of the capacity planning, where you can see where is the demand and where is the supply, and of course where is the gap and opportunities for the investors. And especially you saw from my previous slide that the market share has been rising from public sector to the private sector. So therefore there is a lot of opportunity that the private can take over from different speciality that been addressed in this slide. And of course, it has shown that there are quite a gap in certain specialties like orthopedic, obstetric, or pediatric. If you really want more details on this slide, basically you just log into DHA's website and search for Investment Guide 2019, and hopefully we will update this guide for the version of Expo 2021. And it has shown greatly that there is a great gap in terms of the primary healthcare, like an innovative primary healthcare, long-term rehabilitations, which is a very, very important areas, including mental health and others. Can you go to the next slide, please? So anything in green here, that means there is a gap. So there is an opportunity, you can pitch for it. And anything in red, that means it's an oversupply. So it's better better not to look at it at this stage until we validate the number after 5 years, and then from there we can look at it in the next another 5 years. So you can see that where is the gap in terms of the outpatient services in various specialities. So anyone who is interested basically on these specialities, so it's very clearly addressed even in investment guide as per Dubai zones as well. Dubai is being divided in various sectors, and it shows that where those specialities are missing or there is a gap in the services, and where these specialities being oversupplied in certain sector. Next slide, please. So this is same thing like the previous slide, but this is mainly addressed for the inpatient. So you can see for the gaps in terms of the specialty of inpatients till 2025, and you can see in certain areas like long-term rehabilitation, mental health, and other services where it requires an inpatient's investment in these specialities. Next slide, please. So this is a very interesting slide, and this is basically, it showed that in the next 2 to 3 years, where our focus is in various services. It's been addressed on the previous 2 slides, but however, these are the main ones where we are looking for it in the future. So next 2 to 3 years, we will focus on the primary healthcare, for instance, ambulatory care, urgent care, long-term rehabilitations. And of course, in the 3 to 5 years, we want to focus more on precision medicine, nursing home cares, and palliative medicine. Next slide, please. And if you look at this slide, this is a slide will show you how basically the whole process of licensing work in terms of facilities. And similar, if you go to the investment guide, you will find it as well for the professionals, and how basically they need to start getting the approval from Dubai municipality as well, DAD and then DHA. However, we as an investment department have worked on something called a certificate of needs. And this certificate of needs will balance between demand and supply to avoid any oversupply in the market. So the implementation of the certificate of needs will be done by the licensing and regulation, hopefully on the first quarter of next year. So if anyone is interested to, say for instance, they want to apply to open a services like long-term or rehabilitations, they need to go through the certificate of needs, where they will make sure what this will meet the needs of the populations and will cater the services. And here you can basically reserve the right of the investors, as well as you can get some incentives in terms of lands, empowerment in the government health insurance and other stuff. So hopefully with having a certificate of needs, we'll control the market and try to balance between supply and demand. Next slide, please. So let's speak or talk a little bit more about the various PPP model which is really, it's our interest. And we all know that the PPP law is out in Dubai since 2015, and PPP is usually enhancing and focusing a lot on various model of partnership. And we all know why we want to do PPP is basically to build up a proper business feasibility case where you have a proper kind of a distribution of the risk between the public and the private sector. And of course, we have to discuss matter of the financing, how we basically want to do it, and what will be a win-win situation for both the public and private sector. Next slide. And I'm sure United Kingdom was leading in terms of public-private partnership. And we have seen a various model across the world. Australia, Canada, Spain, South America has done a lot of those PPP projects, from small versions such as operational management to a real huge infrastructure PPP. That's a similar thing we are as well adopting to meet the needs of our projects, as well as to cater the service to our populations. Next slide. So if you really want to look about the PPP law and PPP guideline, please, you have to log into the Department of the Finance website, where basically you can have an access to the guidelines and to the law, and you can look at what is the requirement from the public and from the private sector. Next slide, please. Okay, this is very interesting. We are currently working on phase 2 of Cardiology Center of Excellence PPP. This is honestly, we have done with the phase 1. We worked with our consultants, and we are now into phase 2. Phase 2 RFQ is closed. We are now finalizing for the RFP. It's a very interesting model where the private sector would design, build, finance, and they will manage from the facility management and then transfer the facility back to the government after 25 years of the contract, while the private sector will run or will operate clinically, and the public sector will commit in terms of the unitary payment on the period of the contract. It's a very interesting project. We got a very good response from all over the world, and UK honestly had a strong interest in this project for such a model. Let's go to the final slide. Among the Cardiology Center of Excellence PPP projects, we are currently working on the various projects. Dialysis, the only project is going to be closed this week. The rest is project is still there. Please keep a close eye on our GRP system, where you can have an access to those RFP. Some of them is still under study and under feasibility study, especially like radiology, and there will be more projects coming up in 2021. And the base of those projects, either infrastructure or it could be a service PPP projects like dialysis. It's mainly an operational management kind of a projects. And the reason why we are doing PPP, we're all aware because we want to improve the quality of services. We want to have a better financing. Definitely, we want better outcomes and quality and international standard as well. I think this is all for me, and I leave the floor for my rest of the colleagues. Thank you very much.
Dr. Ibtesam, thank you very much. And I think you touched on it there at the end, that this is all about quality. And I think what you're doing at the Dubai Health Authority is really all about that, in terms of providing, I think, as much information as I've seen from any government department in the UAE around the needs, the investment case, and things like, you know, the certificate of needs that you mentioned is such a good idea to allow potential investors in Dubai to really qualify and avoid, you know, potentially expensive mistakes in developing an investment where there isn't the demand. But I think everything you said there, and I can attest to it, that the visibility and availability of information is first class. Moving on now. Pleasure, thank you. So moving on now to Dubai Science Park and to Mr. Marwan Abdulaziz Janahi, who's the Managing Director at Dubai Science Park, which is a more recent addition to the Dubai landscape, but no less successful, and operates in some of the more forward-looking and cutting-edge areas of the healthcare sector. So Marwan, over to you.
Thank you very much, Joe, and everyone else, the team at Dubai FDI, for engaging us in these such webinars. I think it's important that we talk about the opportunities that are available here in Dubai for British companies, because I think it's quite an exciting time post-COVID. Next slide, please. So I'd like to spend a few minutes talking about DSP, and then we hope to receive some questions from your side to make it interactive. Dubai Science Park was established in 2005. It is home to more than 350 companies, from multinational corporations to SMEs. These companies employ more than 3,600 industry professionals in the region's first science-focused business community that reinforces UAE as a destination for research and development. Next slide, please. So we really aspire to be a community for companies in the science sector, from pharmaceuticals to medical device, medical equipment, but also we are actively in the areas of renewable energy and energy efficiency. So it is not only the healthcare is about 60% of our companies, but the other 40% constitute renewable energy. Next slide, please. Our community is home to 11 UK companies. They are involved in a broad range of industries, including renewable energy, wastewater treatment, therapeutics, life sciences, pharmaceuticals, and air quality monitoring. Next slide, please. Some of the most well-known companies, before I move on, British companies based here are multinational consumer goods giant Reckitt Benckiser, which produces well-known brands such as Dettol, and I'm sure you know about many other brands. In addition to Mundi Pharma's European arm that is also based here, and also the consultancy firm TTM Associates. So how do we attract these companies? The way we look at it is that we look at the activities of the companies from research and development to manufacturing to distribution to marketing, and we make sure that we have an asset or a facility that companies can use to make sure that we support the setup of the companies. Being a free zone, we handle the setup of the companies and we advise them on what is the right setup for them. Next slide, please. Dubai Science Park is a strategic driver for the Dubai Industrial Strategy 2030 with a focus on pharmaceuticals, medical equipment, priority subsectors. Last year, we made major progress by completing 60% of the phase 1 objectives. We continue to work very hard in attracting investments and also supporting local manufacturers and forge strategic partnerships and improve regulations. Next slide, please. Our business partners have been really at the heart of the UAE's response to COVID-19, providing testing, tracing, disinfection, and diagnosis services. To name a few companies that were involved, Thermo Fisher Scientific, Biorad, are among the US companies here leading this change to mobilize resources and combat the pandemic by augmenting the UAE's tracing and testing capabilities with world-class medical expertise and innovation. Next slide, please. So what is next? I think the opportunity that really presents itself is by connecting the dots between UK companies and what is happening here, whether it is in healthcare services, whether it is in pharmaceuticals, in medical device, and also digital health is a very exciting area for connecting the doctors to the right facilities, to the right patients. Next slide, please. We also promote careers in STEM related fields by encouraging greater partnership with universities. Last year, we held the Middle East's first Green Light for Girls initiative to promote careers in STEM for young women. Next slide, please. We also act as a developer for companies who wish to build their R&D infrastructure here in Dubai. So we are currently undergoing 3 projects, building 3 R&D centers for companies that are mentioned in the slide: Himalaya, Firmenich, and Jotun. It's also important to note that we have a pharmaceutical manufacturing plant here in Dubai Science Park with an investment of over $30 million. They produce oral dosage products, and they are open for partnerships with many companies. They already do a secondary and primary batch release for companies from Europe and the US, and I think they would be more than happy to connect with you. Next slide, please. So I think as a conclusion, Dubai Science Park is really a unique destination when it comes to science and life sciences in specific, where we cater to a one-man show all the way to a factory. So if you're someone with an idea who wants to validate the market, or a scientist who wants to test their idea, or a large company that is here to establish, regional headquarters, or even a factory that wants to produce, we are able to help you in whichever stage you are. And I think with the 350 companies that we have, we're able to make very meaningful connections. So even if you, before taking that step, please do give us a call, let us know. I'm sure we'll have someone who can help. Thank you.
Marwan, thank you very much. And actually, there's a lot there that I wasn't so aware of, not least the degree of pharmaceutical manufacture and activity in Dubai Science Park. I was actually talking to a company this morning who was asking me about doing contract manufacturing in the UAE. So I think I might give you a call afterwards, because I think it's a very relevant conversation. So thank you very much.
No problem.
Moving on now, back to Dubai FDI, who are going to run through their Dubai Advantage overview. And joining us for this is, Waleed, is Mr. Waleed Marhoon, who is taking over from Ibrahim, who did the original address. So Waleed's one of the Dubai FDI investment promotion team, who we know very well, and he's helped lots and lots of UK companies, both through the BCB and directly, and is going to give us the Dubai Advantage overview here on the healthcare sector. So Waleed, welcome to you.
Thank you very much, Joe. And first of all, I would like to thank all the participants who's today with us from UK, and to my colleague who's joining us this webinar today. It truly gives me a great pleasure today to be part of this webinar. And starting of my presentation, we'll go through the Dubai Advantage, which will have an overview about Dubai as a city, what it can offer for the investors. Next slide, please. Talking about Dubai as the city, if we move to the next slide, please. Dubai has a very diversity economy, and Dubai GDP contribution in 2019, as it shows here on the slides, has caused the majority to the wholesales and retail trade, which contribute 26.6% of the entire GDP of the year 2019, followed by storage and transportation, which goes 12.8%, and so on. Next slide, please. Next slide. Dubai is the gateway for the region, and it's occupied a very strategic and unique location in the world. Talking about Dubai as a gateway, it's a gateway for 2.4 billion consumer direct market on the region, specifically on the Middle East, India subcontinent, and East Africa. Next slide, please. Next slide. We are witnessing to host the biggest expo on the MESA region, Expo 2020, which is supposed to be held this month, which is supposed to be next week actually, but due to pandemic and the current crisis, the committee has moved the event to next year, which is going to start from the 1st of October 2021 through 31st of March 2022. It's going to be first time World Expo happening on the region. The Expo will be attracting 25 million visitors expected to be attending. 70% of them are internationally. The theme of the Expo will be Connecting Mind. Can you go back, please? The theme of the Expo will be Connecting Mind, Creating the Future, and the sub-theme Mobility, Sustainability, and Opportunity. UK Pavilion will be participating on the Opportunity District, and it will be highlighting mainly on the AI and space sector. The theme of the UK Pavilion is innovating for the shared future. Next slide, please. Next slide. Dubai has a very strong infrastructures and modern growing all the time. 100 billion US dollar has been invested on the road and transport infrastructure. In 2009, Dubai has launched the longest driverless metro in the world, 74.6 kilometer, and will be expanded to 421 kilometer planned in 2030. And Dubai has been ranked as #3 preferred destination for infrastructure investment. Next slide, please. Dubai Plan 2021. The plan addressed the city development and all aspects, and it will be a healthy, innovative, and happy individual. The plan is, it has 6 themes. Number 1, as shows on the screen, a secure place to live, transparent and preferred investment destination, multicultural society, smart, sustainable, and economic growth and sustainable. Next slide, please. Next slide. In 2014, the government has launched the Smart City Initiative. 100% of the government transaction will be paper-free by 2021. Next slide. Dubai blockchain strategy. Dubai is the first city full power by blockchain of the year of 2020. And the strategy has 3 main pillars. Number 1, which is eliminate 100 million annual paper transaction, which will save 100.5 US billion. Number 2, the first ever world government using blockchain for all transactions by the year of 2020, which means most of the government transactions has been online or using the application on the smartphones. It's not necessary for the investor, for example, to come physically to DED, Dubai Economy, to renew the license. The services can be all done through the smartphone. Number 3, Dubai will be the first blockchain powered during the future. And this slide is give you the data and the number of the usage of the technology as is shown on the screen. Of course, most of the users goes for the mobile phone, and as well Dubai open data law for individual users and government and private sector using. Next slide. The artificial intelligence in the UAE. The country has dedicated ministry for the artificial intelligence. By 2035, this sector will add 182 US billion to the entire country GDP, and the artificial intelligence will impact 15 sectors in the entire country. And as shown on the screen, some of the sectors here, such as financial service sector, healthcare, and construction sector. Most of the investment amount that the government has invested for the artificial intelligence will go to the financial service sector, followed by healthcare sector. Next slide, please. Federal Science and Technology and Innovation Policy. This will be targeting 40% increase in the knowledge worker by 2021. 82 US billion has been put it in the pool to invest it on the different sectors. Most of the such as space sector, academic research sector, and clean energy projects. Next slide. The manufacturing sector in Dubai, it's Dubai well known as a light manufacturing sector destination. And the strategy of the government is aimed to increase the total GDP on the manufacturing sector. And of course, Dubai to be a home for a business by making it a platform for manufacturing, as well environmentally sustainable for manufacturing platform. Therefore, the government of Dubai has set 6 specific industrial sector, which are aerospace, maritime, pharmaceutical, fast-moving, and machinery and equipment. Next slide, please. I've reached to the end of my presentation today. I would like to conclude this program by thanking our stakeholders for their continuous support, such as DHA. Thank you, Dr. Ibtesam, and Dubai Science Park, Mr. Marwan Al-Janahi, and a special thanks as well for OCO team for organizing this webinar today. Thank you, and looking forward for any questions to be answered. Thank you.
Thank you, Waleed, and we've had a few questions in. I'd encourage anyone who's on to send a couple more through, please. And I think the thing that always gets me when I see that presentation that you gave there, Waleed, is the UAE has a minister for AI, has a minister for happiness. There's a science and technology and innovation national policy. There are all of these sort of very forward-looking enterprises and initiatives that, I think when the UAE announced a minister for happiness, there was probably a little bit of people laughing elsewhere in the world, but now I think mental health and wellness is so central to everything we do, that it's seen now as a really foresighted and good decision. Next slide. I think we have one final video just outlining Dubai as a global healthcare hub, and then we will go to the Q&A. Great. Well, we'll move on to the Q&A now. And I think one of very interesting thing to say on the Dubai hub position is that just in the course of the last 5 weeks, Dubai can now act as a hub for any business you're wanting to do in Israel. And I don't think that was something we were expecting to see this year, and I think in some cases for some time yet. But the détente and the resumption of relationships between the UAE and Israel, which was formalized last month, has already seen a huge influx of business, trade and investment interest. And obviously, that's an area where Israel has a number of world-leading companies in biotech, in health tech. We're already seeing that. So we're over to the Q&A now. There has been a couple already, and I know Dr. Ibtesam has already addressed it, but I think it would be a good one just to draw out. So thank you, Dr. Martin from Meta Health, asking a question there around the gap analysis for medical tourism and what sort of impact that COVID's had on that analysis.
Thank you, Joe. Honestly, we all know that COVID-19 had a dreadful impact on all the tourisms and airline industries and hotels and others. However, in 2019, Dubai was leading in four major specialities for health tourism. One of them is cosmetic, dental, fertility, as well orthopedic. These are the four major specialities. Basically was the hub in Dubai where a lot of GCC and other people used to come and treat themselves in Dubai. However, this is still the case because of the niche area and because of the talented people that it's been attracted in the city. But to keep in mind our capacity planning, when we have done it, we have taken all these numbers into considerations. So if they can have an access to investment guide, they can see what happened previous and how basically we're going to factor in 2025 and 2030. But because of the COVID-19, we're going to revise some of those numbers and hopefully by next year, and we should have a new version by 2021. I'm sure there will be an impact, but in terms of the specialities and in terms of the services that we have addressed, it almost will be the same.
Very good. Thank you. Thank you, Doctor. I think one here that came in on the email, and I'm going to go to you for this, Marwan. I mean, it's also, as you would expect, a COVID-related question. How has that impacted, and I guess it's for you, Marwan, and for Waleed and Ibrahim, how has COVID impacted inward investment flows and appetite, and what have you seen in short term, and what's the pipeline looking like over the next 6 months?
I think, I mean, the healthcare sector is resilient when it comes to, such pandemics. The impact was positive on companies that, have PCR machines, for example, and we have two of them here, Thermo Fisher and Biorad, and also laboratories that do the testing. And I think also COVID, during the lockdown and even prior to that, people were more aware of their health, and I think things like mental health became more important, and I know people were more active, exercising more, taking care of their health. So healthcare companies, I think the ones that are here were mostly fine. There were some of them that were working in the operating rooms, for example. They had a little bit of a slowdown because some of the operations were put on hold. So they had a little bit of a negative impact. But for the last 3 weeks, we have been extremely busy. I think there was like a pause, for 3 months, and now everyone is coming back in. The flights are open. We're having meetings here in the office. We're having it virtually. So I can say that, we're back to business, and, it's back to normal. And also we're discussing different opportunities with companies.
Very good. Thanks. And Waleed or Ibrahim
Yeah, I would like to add a few points beside Marwan points. We've noticed as well as, especially on the healthcare sector during the COVID-19, lots of the pharmaceutical company and the company who provide the supply of the health, such as masks, gloves, which has been a big required for the people. We've got lots of, some of the company who would like to seek for the opportunity to expand their business in Dubai. And COVID bring the awareness for the society here, as Marwan mentioned, to be more aware about their health, following the protocol of taking care about their health lifestyle, I would say. Of course, for us and for the entire region, for the world, is something newly happened and give us like a new experience how to be more aware about such things. One more thing we have noticed also, that the e-commerce has been incredibly grow in Dubai specifically, which people has been moving from the normal tradition of shopping. Pharmacies has been providing all the online services where the consumer can reach to get all their needs from the medication directly from the applications, as well the telemedicine where patient can get their consultants directly with the doctors without physical visiting. And this has been bring the awareness of the e-commerce on Dubai.
Got you. Thanks, Walid. And I'm familiar. I mean, thankfully, I've not had to go to a doctor, but I know people who have been doing it over their phones and having, you know, really thorough and quality interactions with physicians on via, you know, media that they would never have considered 6 months ago. Question here from Lynn Saint from the University of Birmingham in Dubai. And this is for you, Dr. Ibtesam, are the DHA public-private partnerships open to universities for R&D and other collaborations?
Yes, indeed. We are looking at a various type of the PPP projects, whether it's a research, educations, because we do have continuous medical education existing in DHA. There is various collaboration between our department and the various universities in the world. And it depends, as I mentioned, whether this is really a requirement. So they can discuss on a various opportunity, and based on the project itself, what kind of a model of the PPP they are looking for. And research and development is one of the strategic element and initiatives of the DHA strategy of 2021.
Thank you. And Dr. Ibtessam's email address is there for you to follow up on that one, and Lynn. Brad, a question for you, if I can, and I can't remember what sort of numbers of your membership is in the healthcare sector, but have you picked up anything there on the bilateral basis, COVID related or not, in terms of trends and things amongst your members, or in the sector that would be relevant here?
It's still quite early days, but we've got 5 working groups, and I think for all of them, how both the UK and the UAE can collaborate together and respond to COVID will be a theme that underpins all of those working groups. So those 5 working groups are in innovation, future technology, and the 4th industrial revolution, education, skills and culture, healthcare, as I mentioned, energy and industry and infrastructure. And I think all of the co-chairs who are now thinking through what the priorities and things should be, I think they all have, COVID and the post-COVID, recovery as something that they want to address. And I think they both see that there are opportunities for having a dialogue with each other and looking for new opportunities to work on that area. So I would say that COVID will be a theme across all of the sectors that we cover in the Business Council.
Thank you. Question that came in on email, and I'll put this in general, and I'm not sure who will answer it, but we've been talking about telehealth, e-health, med tech, data, effectively. Could you give some clarification on a lot of British companies are obviously familiar with the Amazon Web Services, the Microsoft Azures and the clouds. How does that work in terms of then medical data in Dubai and the UAE and rules in terms of where data needs to be held? Putting that out in hope that we have a data expert there, and can anyone comment on that?
I can. There was a law, a patient privacy law that was issued in I think it was February of 2019. That basically calls for all data to be stored locally. However, there was a big pushback from people using digital health and digital platforms, because a lot of the data of patients were actually shared with other countries. So, for example, if you want, a second opinion, you're a hospital in the UAE and you'd like a second opinion, elsewhere, the law actually does not allow that. So so there was a pushback from the people in this area, and the Ministry of Health is now putting together guidelines to provide a little bit of flexibility, because it's quite a limiting law.
Thank you, Doctor.
Victoria?
Can I add?
Please, yes.
Well, telehealth, I would say, because it consists of so many other stuff, from telemedicine, digital, virtuals, the cloud. There is by law TRA, it's what I know that it should be within the country. So yes, there was a policy, and they are working on a policy for telemedicine itself, where the companies are allowed to digitally consult with the patients, and our insurance accept patients through the digital medicine. And COVID-19 actually expedited that service. And it created kind of like a platform media between the primary care, polyclinic, and the hospitals, which was a very amazing kind of a step happen. And I think this is one of the positive outcome of COVID-19. But we really need to have a policy to work around that. As Marwan mentioned, we do have for internal consultation, but for the second opinion, we have limitations and restriction, because these companies should have a tie-up with a certain institute worldwide, and their regulations and licensing should be compatible with us. So therefore, yes, the liabilities and the patient confidentialities should be secured. So that's the reason. It's actually huge homework, and Ministry of Health, as well as DHA and other health authorities, they're working together in developing something around this area.
Thank you. I mean, I guess it's the key area at the moment, but it sounds like it's moving quickly and something for everyone to keep their eyes on. I think we've made very good time, but I think we've exhausted our questions as well. So unless anything pops, somebody's in the nick of time. From Lawrence Metham, thank you, Lawrence. What specific collaboration opportunities are there for medical facilitation companies based in the UK? Doctor, you nodded there, so I'm going to go to you. Are you able to help answer that? And then Marwan, I'll come on to you.
I mentioned a couple of PPP projects, and especially in Cardiology Center of Excellence, UK was one of the UK companies. I can't disclose at this stage, but they were very much interested, and actually they are shortlisted now. And so we have various companies, whether it comes from the equipment, technology, services, constructions, design. So it depends basically on the various projects that we're working on. And I believe in 2021, we will have even more projects coming up. I feel COVID-19 honestly has strengthened the public-private partnership. And that's has caused a lot of positive impact in the market, and encourage a lot of healthcare investments and businesses, which is really great. There are many companies basically are interested in our projects from UK, whether it's operation, service, equipment, pharmas, and others.
Thank you. Marwan?
I'm not quite sure about what medical facilitation means. Is that companies that would facilitate medical tourism, or is that companies?
Actually, Lawrence, that's a good question. I've also got a slightly different understanding. Could you just type into the box there, Lawrence, just a little bit more color, and then Marwan and other panelists will address you.
Yeah. I mean, if it's medical tourism, I think there is definitely also a great opportunity because you know the UAE is really a magnet for a lot of tourists and people who come here for medical tourism. But at the end of the day, there are specialties that we do not have, and the UK can be okay. So it is for medical tourism. I think a lot can be done, and Dr. Ibtesam, you can add to what I'm saying, because some of the specialties, like oncology, for example, you know, other neurological issues that are very niche, you know, can be, we can build like a bridge between Dubai and the UK for it.
Mm.
Yes, patients coming to UK, we do have certain areas, and we do have a department called overseas treatment department, where we are sending patients to various countries, including UK. And it depends basically from case to case. But Dubai now reaching to somehow at certain stage, certain maturities in some specialities. But of course, there are you know, other countries leading us, and we lag behind in other specialities, where definitely we are sending patients to UK. As you mentioned, Marwan, oncology is one of them. There are cardiology, some of them are rehab, and cases that cannot be manageable within the country. So yes, that's still there. And of course, not necessary to be from the patient perspective. It could be from research, like Imperial College. I mean, they have a stronger relationship between the country and UK, where they are doing a lot of research in terms of diabetes. So it's like, you know, we should not only focus on patient. There are lots of areas comes in healthcare where we can collaborate, and we can send patients or send professionals and vice versa. So.
Thank you. And I mean, what comes to mind there is obviously, and I think it was mentioned in Ibrahim's opening, with the likes of Maudsley and Moorfields and King's College, who you know, have brought the supply to the demand, because it makes sense for them to do so. We're going to wrap up there. I think we've exhausted the question, so I'd like to thank the speakers, Ibrahim and Waleed. Bradley, Dr. Ibtesam and Marwan, thank you very much for joining us. Thank you for all of the information you've imparted, and thank you for being so open and sharing that. And you know, I'm sure there'll be some follow-up from the participants. To those of you who've joined us from the UK or the UAE, wherever you are in the world, thank you very much. I hope that's been useful. We're all looking forward to hearing from you to encourage and support your trade and investment journey into the UAE, into Dubai. So please do get in touch, and we wish you a good day ahead. Thank you very much.
Thank you.
Thank you very much. Bye.